There are some new findings that may help change the treatment or the diagnosis or the lifestyle of patients with Parkinson's. Let's jump into that now.
Maybe several of those. The newest thing is, besides these motor symptoms, which we've always taught people to look that these are the symptoms of Parkinson's disease, we knew by the time they came in with those symptoms or started with the tremor or the slowness that they'd already lost 70% of the brain's dopamine. So it was a tipping point,
The brain's dopamine. So that's a key, the dopamine?
Yes.
Where is it in the brain?
It's in the basal ganglia typically, but other areas now that we found too. But that was the typical area of motor movement. And it comes from the substantia nigra, which is in the back of the brain. And what's happening in Parkinson's is a progressive neurodegenerative disease, so they're losing cells early. The cells are dying out that make this chemical. And dopamine is what we call a neurotransmitter, which means it's a chemical that helps transmit signals in the brain.
So if the cells die, no dopamine, patients get the signs and the symptoms. So what are the new findings that are going to help us?
Besides those motor symptoms, we knew that patients came in when we had clinics for Parkinson's disease that they had a lot of other symptoms, and they were non-motor, so they weren't involving the motor system with movement. They were things like constipation, decreased sleep, insomnia, depression, sweating, REM sleep behavior disorders, the loss of your sense of smell. They would have seborrhea around the face, so the skin system was involved. Other systems were involved besides the brain. And we knew they had these, and we used to treat them with them as well, and the medications didn't seem to treat them as well. But now, just as of 6 or 7 years ago, we found out by a pathologist who looked at where the pathology in the brain is with the Lewy body in the cells, and he found that, lo and behold, it started in the olfactory bulb.
That's where the smell is.
Sense of smell. And then it went to the brainstem, and that's where all the sleep disorders came from.
Wow.
And then it went to the basal ganglia, which was the motor system. And then from the motor system, it goes into the cortex, or the upper areas of the brain, which are involved with memory. So that's why they would get a memory issue late in the disease. And we knew those two pieces of the puzzle, but we didn't realize that those things we saw associated with it that are non-motor are the earliest findings of Parkinson's disease.